There. Awesome. All right, let's get started. So my name is Nathan Spitz. I'm a second-year medical student here at the Carver College of Medicine. I have just started my clinical rotation, so we are just starting our time in the hospital, getting to see patients and whatnot. Thank you for signing up for this session. As the title says, this is Get Your Head in the Game, and we're going to talk about how psychiatrists can use neuroscience to treat people. And so we'll maybe do like 5 to 10-ish minutes of like a presentation. And then I know that I had fun playing Kahoot when I was in school. I hope y'all have fun playing Kahoot as well. And hopefully we can use that as a way to kind of like see what we learned throughout the session. Does that sound like a plan to everybody? Yes. Okay. Awesome. So before we get started, does anybody know what a psychiatrist is or what a psychiatrist does? You guys can you don't have to say anything. You don't have to unmute yourself and it's okay if you don't know either. So, what is psychiatrist? So psychiatrists are medical doctors, so that means they go to medical school and they often specialize in treating mental health disorders. And some of those mental health, yeah, Lyric, exactly. Someone who specializes in mental health. And like Lyric had said, they can treat a bunch of different disorders. Lyric had mentioned substance use disorders, so people who may be using things like alcohol or other drugs, people who have anxiety or depression or bipolar disorder or schizophrenia. These are some of the more kind of common mental health disorders that psychiatrists can treat. Do any of you know anybody who may have a mental health condition? Yeah, somebody's saying my friend. Yeah, they're super common. They can affect up to 25% of people. That's, 1 in 4 people throughout their life will have a mental health condition. And so it's pretty important that we have doctors who are specialized to be able to treat those ones. So Carrie said, yep, has dyslexia. Yeah, sometimes they can help treat learning disorders and things like that as well. And so, what psychiatrists do to be able to treat those mental health conditions is they often use a combination of therapy as well as medications. And so, sometimes people, when they think of psychiatry, they think of somebody laying on a couch and talking about all their problems. And therapy is an important component of treating people with mental health conditions, but they also often use medications and neuroscience. And like this, okay, all right, Ethan, there we go. And like the session says, we often use neuroscience and we use our knowledge of the brain, kind of where things can go wrong and cause these mental health conditions. So we use our knowledge of the brain to be able to help treat those. So let's get started. We'll skip this video. And I know people have different levels of understanding and experience with neuroscience, so we'll try and keep it at this kind of entry level. That way everybody can be on the same page. So when we talk about the nervous system, people often like, oh, you hit your funny bone. That's like a nerve, and your nerves are what send messages from your brain to the rest of your body, as well as send messages back to your brain. So we have millions of nerves all throughout our body to be able to, help us move, help us think, as well as to interact or experience the outside world. And so when we think of the nervous system, there are often kind of 2 branches. We have the central nervous system, which is our brain and our spinal cord. And then we have our peripheral nervous system, which is like all the nerves kind of out in your limbs. These are what help you feel. You can have your peripheral nervous system that can feel your finger touching, and it will send that message to your spinal cord. And then in your spinal cord, it will send that message up to your brain. And that's how you know that you're touching something. All right, Larry said, yeah, there are billions and there are so many nerves in our human body. It's pretty wild. So when we kind of break down what these nerves look like, one single nerve cell is called a neuron. So one nerve cell is called a neuron, and we'll kind of break down how this neuron works. So these neurons, they have the cell body. That's kind of like the main hub of the cell. And they have these little fingers over here called dendrites. These dendrites are like the little fingers that get incoming messages. So let's say you touch a hot stove, that kind of electrical signal that's saying like, ouch, that stove is hot, is going to come to your dendrites. And then we'll send the message to the cell body. And the way that nerves, kind of send that message down is called the axon. These axons are what help carry the message down to the end of the nerve cell. That way it can connect with another nerve. So to quickly review, the nerve cells, the main hub is the cell body. It has the dendrites, or the little fingers that kind of receive messages, and then it sends messages down axons so that it can reach another nerve cell. So, we're talking about psychiatry and mental health disorders. And like we said, most of those kind of originate in the brain. So let's kind of talk about, some pretty basic structures of the brain. And so we have two hemispheres, or we have kind of two halves of the brain. So what we're seeing right now is the left side of the brain, or one hemisphere. And it's pretty cool, I think, on how the brain, we have this left hemisphere over here, and this is what controls the right side of the body. So all the messages will cross over to the other side of our body. And for this course, we're going to keep it kind of simple and talk about 4 of the main lobes of the brain. So we have our frontal lobe, as the name implies, kind of up in the front. And this frontal lobe is really important for things like thinking and memory and behavior and movement. So there are a lot of super important things happening in our frontal lobe. Then we have our parietal lobe. That's kind of a funny word, parietal lobe, right behind it. And this parietal lobe is super important for things like language and touch. So, we had kind of talked about if you touch a hot stove, that, heat will travel and your nerves will send electrical signals, and those signals will kind of end in your parietal lobe. Then we have our occipital lobe right in the back of the brain. This is super important for sight. And then lastly, we have our temporal lobe, this kind of funny looking tongue down here. And this temporal lobe is super important for things like hearing and learning. And so, when you have, messages coming in through your ears, or you're hearing me talk right now, those kind of electrical messages are ending in your temporal lobe. And that's what's allowing you to hear. And so Lyric had asked, what about the limbic system? So the limbic system is a little more in depth than what we'll talk about today. But Lyric, for your question, the limbic system is super important for emotions and anxiety and things like that. And so some people will have overactive limbic systems, or they'll have a lot of activity in their limbic system, and that can cause things like anxiety. And then Lyric also asked, what about emotions and memory? And so, yeah, a lot of things, the brain is interconnected. There are all kinds of nerves that connect to different regions of the brain. So for something like memory, we think our frontal lobe is most important. And then we think about, our temporal lobe being more involved with feelings. But there are connections between these two lobes that allow us to have complicated emotions and memories where they can be connected like that. So if we look back at this other picture, there's another structure down here called the cerebellum. This kind of like, I call it the brain butt. So the brain butt is the cerebellum, and this is super important for balance and coordination. When you guys are walking down the street, you probably don't have to think too hard about how you're actually walking. And that's thanks to your cerebellum. It does kind of that automatic processing on its own, so you don't have to think about it. So Ethan said, I have ADHD with that. Yeah, people with ADHD, again, is super common. It's super common, especially amongst kids and people in high school. And psychiatrists can treat people with ADHD. Okay, and so I think this is a pretty funny joke. What do neurons use to talk to each other? But a cell phone, right? They use their cells, or those neurons, to be able to talk to each other. Okay, so that was a really brief overview on the brain. Do you people have any questions before we play Kahoot? Okay, and we can also answer questions while we're playing Kahoot. So I'm going to pull up Kahoot, and then I'm going to stop sharing my screen. I'm going to pull up the game pin. So the game pin is, do you all know how to access Kahoot? Okay, I'm going to put the link into the chat. So go to let's go to www.kahoot.it. So if everybody could log in here, and then I'm going to put the game pin in the chat. Okay, let's see. So the game pin is 5007938. Oops. All right, did you all get that? Did you get the game pin? Okay, all right. See, Aaron.
How do I access it? Because it won't let me like small in the Zoom call so I can.
Oh, can you hit escape?
Okay.
Sometimes if you hit escape on the keyboard, that will make the Zoom screen smaller.
Yeah, I just did that.
Okay. Is that working?
Yeah.
Okay, awesome.
Okay, yeah, here we go.
While we're waiting for everybody to join, do y'all have, I know that was super quick, do y'all have kind of questions about the brain, psychiatry, anything like that? And it's okay if you don't too. Okay, we got 6 people. So
Yeah.
Harley's saying it won't let me in.
Can you get a game pin?
Yes, yep. There we go. Everybody's posting it. So Addie and Emma had said, what lobe of the brain is responsible for ADHD? That's a really good question. So ADHD, or attention deficit hyperactivity disorder, is super common, and it's, sometimes it's not necessarily a lobe of the brain that's gone, that is a little different in people with ADHD. What they kind of think, they still don't really know the answer. Okay. Sorry, Harley, I'm sorry. Are you on Kahoot.it? Yes, for ADHD people, they think it's a lack of, okay, and then the game, I'm going to put the game pin again, 5007938. Don't put the backslash. So Lyric's saying the frontal lobe that helps people organize, plan, and so yes, for ADHD, sometimes like that is an important part of your frontal lobe. But like we said, there are a bunch of connections throughout your brain. And so it's more a neurotransmitter called, I cannot find the link and missed the lesson. Okay, I'm sorry. We have maybe like 10 minutes. So we need to get started. But it's a neurotransmitter called dopamine, and this neurotransmitter called dopamine can help us stay focused. And so for people with ADHD, sometimes there are imbalances or different levels of dopamine, and that can cause sometimes people having trouble to be able to pay attention for long times. So there's not necessarily a lobe of the brain that is dysfunctional. It's more so how those different lobes are connecting. Okay, so there are 10 people in. Let's get started. Okay, I'm going to share my screen too, just in case anybody.
What do you need? I can't get in.
Okay, let's get started, everybody. Okay, this is Kids Ghost. I forgot to change the name. All right, so what's the system that controls all of our thoughts and movements? Oh, I love Kahoot's music. That's so fun. All right, nice job, everybody. Okay, There we go. You got it. So it's the nervous system. And remember, we have our central nervous system, or our brain and our spinal cord. And then we have our peripheral nervous system, or all the nerves outside. Okay. So let's go to next. All right. Nice job, everybody. Let's go on to question 2. Who remembers the 4 lobes of the brain? All right, this one might be a little more tricky. All right, we got answers coming in. All right, so we got 7 people out of the 3 getting it right. And the 4 lobes of the brain are the frontal, temporal, parietal, and occipital. In these next questions, we'll kind of break down more so what these lobes of the brain do. All right, the leaderboard. We got Emma, Emily, Diego, Lyric, and we got Yeet on the leaderboard. Okay, who remembers what the occipital lobe's function is? So we got smelling farts, watching a TikTok, feeling your dog's fur, or hearing your phone ring. All right, ooh, that one was pretty tricky. So the occipital lobe, if you remember, is that part of the brain in the back, and it's super important for vision. And so one of these answer choices, what would help with vision or be important for vision would be watching a TikTok, right? That's kind of like the main sense that you're using. I saw a lot of people put feeling your dog's fur. So that's tricky. And feeling your dog, does anybody remember which lobe would be important for feeling and touch and sensation? Does anybody remember? No, this was the one with the weird name. So the parietal lobe is what's super important for sensation, or being able to feel a dog's fur. Yeah, Addie and Emma, that's right, the parietal lobe. Exactly. So this one was kind of tricky. It kind of required you to remember those 4 lobes of the brain and then also apply it to a new situation. So that was kind of tricky. All right, so we got Emma Brinkley, Aaron, Emily, Diego, and Lyric on the leaderboard. Okay, so we just talked about this. Who remembers what the parietal lobe's function is? Okay, I kind of gave you guys this answer, but it's still, important. All right, there we go. Most of y'all got it, that we just talked about the parietal lobe being what's super important for sensation. And so some people would put yelling at your parents or talking. And so if you're thinking more about movement and like moving your mouth, that would be who remembers what lobe is super important for movement and action and things like that? Does anybody remember? Yeah, Addie and Emma in the chat. That's right. Your frontal lobe. Oh, it's just Emma. Okay. Your frontal lobe is what's super important for talking and movement and things like that. And then somebody put seeing, and we had just kind of talked about which lobe of the brain is super important for vision, and that's the occipital lobe. Whereas the question had asked the parietal lobe, which like most of y'all had put is feeling and sensation. Okay, we got some movement on the leaderboard. Mabel's got 3 in a row. Nice job. Okay, question 5. What is the small part of the brain that controls movement and balance? It was what I'd kind of called the brain butt. All right, we got 5 seconds. Nice job, everybody. Yes, so the brain butt, or the part of the brain on the bottom that controls movement and balance, is the cerebellum. So nice job, everybody. I saw a couple of people put cortex, and your cortex is kind of like the thin outer layer of your brain that kind of, surrounds your whole brain. Whereas the part on the bottom of your brain that controls, movement and balance and kind of makes, it helps your kind of automatic movements like walking, that would be your cerebellum. All right, nice job, everybody. Okay, question 6. Which part of the neuron receives information? I was calling these the little fingers. They're what receive those messages on the neuron. All right, nice job, everybody. Most of y'all got it right. Those dendrites are those little fingers on the edge of the neuron that kind of receive those messages and help spread it down. So that was kind of tricky. I put this one in here to kind of trick people. These are dendrites. These aren't really a thing. Or dabrites. And then, yeah, okay, so we have time for one more Kahoot question. All right, and then which part of the neuron sends out this electrical information to the next neuron? All right, most of y'all got that right. Exactly, it's the axon. That's kind of the long, if you see my mouse, the kind of long part of the neuron that helps send those messages down to the next neuron. So it is 10:54. I know this session ends at 10:55 so that y'all have time to head to your next one. In this last kind of minute or two, do y'all have any type of questions about what psychiatry is or what we talked about? Nope. Okay, not seeing anything in the chat. Alrighty. Well, if y'all don't have any questions, you are free to go to your next one. I hope that you have fun learning about whatever you choose to learn about. Good luck in school, and thanks for coming. All right, bye, everybody.